Well, as Dr. Schiff said, he and I work really closely together as far as referring patients back and forth between his office and ours. And the reason for that is because sexual dysfunction will actually precede coronary artery disease by about 5 years. If you've already started to identify that you have some vascular issues, your body doesn't say, I'm going to pick on one area and leave the rest of you alone. Usually if you have a vascular issue in one area, you usually will eventually exhibit vascular problems elsewhere. And of course, one of the major priorities is coronary artery disease. And if you think about it, the risk factors for coronary artery disease are many times the same risk factors that will manifest vascular issues that result in sexual dysfunction. Specifically, we call them the big five. Obviously, we can't control who we're related to, so family history is one of them. Smoking, tobacco dependency, very, very high risk for vascular issues. And we'll go into a little bit why that is in just a few minutes. Diabetes. We know diabetes affects vascular problems. Hypertension, high blood pressure. You go to the doctor and you say, well, I have high blood pressure. Why is that a concern? We'll talk about that. And then the last one is cholesterol issues. So out of those 5, 4 are modifiable risk factors. All of those risk factors in some way damage what we call the intimal lining of vessels. High blood pressure, it's called the silent killer for a reason. When your blood pressure is high, the velocity of that blood going through those vessels is much higher. The shear force around those vessels damages the lining in those vessels and causes sometimes premature proliferation of the vessel and narrows them down. This is the same. High blood sugars, we know, affects, again, the intimal lining of the arteries. Same with cholesterol, same with tobacco dependency. All of those damage that lining. And if you think about it, in proportion, the vessels in the sexual area, in the penis especially, those vessels are very, very small. If you're going to have damage to vessels, it's going to exhibit a symptom much sooner than would your coronary arteries, because your coronary artery is a little bit bigger. So about 5 years or so, if you're having some vascular issues causing you sexual dysfunction, down the line, we're going to probably see you in our office and need to do a workup on you for cardiovascular disease as well. That's why it's so important, when we identify somebody has high blood pressure. We've got young guys who are in their 30s. They have high blood pressure. They go, why do I care? Well, again, as you get a little bit older, after many years of that blood pressure being so high, you've actually started to damage vessels. You've actually started to change the thickness and structure of your heart muscle. They begin to start having some sexual problems. And a lot of times, I'll tell you, I have guys that are hesitant to take blood pressure medication because they feel that it's going to cause sexual dysfunction. Yes, there are some medications that do that, but then I turn around and tell them, you don't treat your blood pressure, you will have sexual dysfunction for other reason. And it's because you've damaged that vascular bed.